Hello and welcome to yet another edition of Arirang TV's COVID-19 pandemic. I'm Min Son-hee. 3 billion people in 70 countries across the world are now under lockdown as part of efforts to curb the outbreak. We have more on that in today's coverage. But first, as always, I have Kwon Soa and Noah Ram with the headlines. Welcome.
Hi.
Hello.
So let's start with the updates in Korea. A new month has started and we're hoping for a different end, perhaps, this month.
Right. It kind of feels like the first 3 months of 2020 went by so fast because we have actually started the year with COVID-19 reports day by day. And do you guys actually remember when the first outbreak was here in Korea?
I think it was
sometime
late
mid-January.
Yeah, January.
Right,
Yeah.
between mid and end of January 20th. So meaning it's been almost 2.5 months since we've been coping with the pandemic here in Korea. And we are nearing 10,000 cases now, 9,887 to be exact when we take a look at our table. And as we have 101 new cases, that's 24 less than yesterday, and 3 more deaths, and almost 160 people who have fully recovered. The government has been announcing official cases on a 24-hour basis for some weeks now. Before, they had more than once a day briefings and number updates. But let's take a look at back when the first case broke out. From January 20th, cases started to slowly emerge. Then we had the huge surge due to the massive cluster infection in Daegu, with more than 900 cases confirmed in a day by the end of February. Then after tens of thousands of testings, gradually the numbers went down to around the hundreds. And now we are going back and forth between double digits and 3-digit numbers. Now, as stronger measures are taking effect this April, the stronger entrance measures, which Aram is going to talk about later on, and also the indefinite delay of schools, as well as financial support to the nation's people. Let's hope for more stabilization. Now, according to the government's latest briefing on COVID-19, cluster infections and imported cases account for the majority of new cases. We have 24 in Seoul, 20 in Daegu. Most of these are related to churches and hospitals. We had 36 new overseas cases, with 7 of those detected at the airport. Meanwhile, the first of 2 government-chartered flights from Italy carrying more than 300 South Koreans and their families is to arrive this afternoon. That's expected to be at 2 p.m. So probably as we're speaking, maybe the plane has arrived, which departed earlier from Milan. Now, tomorrow's second plane is expected to depart from Rome.
Right, and we'll hope a safe return for them and a safe checkup. Let's go over to the U.S. I understand authorities there are bracing for the worst to come.
Right. The U.S. government scientists predict at least 100,000 Americans are to die from COVID-19. Dr. Anthony S. Fauci, a leading infectious disease expert, made that forecast at a White House briefing on Tuesday. But officials vowed to do everything to reduce that number. U.S. President Donald Trump said the next 2 weeks will be very, very painful. Despite increased action to contain the virus, the U.S. has tested less people per capita than Korea and Italy. Until Tuesday evening, the country recorded its biggest daily death toll of more than 850 people. New York, the hotspot in the U.S., has surpassed China's Wuhan city in cases at almost 80,000. And meanwhile, closely followed by Spain with 94,000. And Spain, in fact, reports the highest daily death toll with 849 deaths. And China has postponed its national college entrance exam by a month to July. And that although actually China now sees 0 new cases between Tuesday and Wednesday. Well, according to the official government numbers, that is. And neighboring Japan has added 49 nations and territories on its entrance ban list. And there the cases are surging as well with 200 new daily cases. That is also a daily record for Japan. And of course, these entrance bans are also going to affect us, South Korea. Right. So that's the updates on the global front.
Right, so thank you for that. Aram, I understand we have stricter entry restrictions for all arrivals to Korea starting from today.
Yeah, so we did have strong entry restrictions for those coming in from the US and Europe, and now that measure has been expanded to the whole of the world. Basically, any new overseas arrivals from today will be placed under a 2-week quarantine, and it applies to both Korean nationals and foreign nationals alike. The move is an expansion, as I said, from the measures from those coming in from the US and Europe. Those who do not have a place of residence in Korea will be allocated a government facility for these people to reside in for the time being, but the people do have to pay about 101, which is about $82 a day, to use those facilities. And everyone must also install this mobile app that we've been hearing about, where the authorities can monitor the people, the foreigners or Korean nationals that have come in from abroad. And also that app is used for the people to notify authorities of whether they have any symptoms or not. And those entering the country on official business or humanitarian means are exempt, as well as diplomats and foreign government officials, but they are still going to be subject to the tests. And others who want exemption must get a waiver from the South Korean embassies in their respective countries in advance. And violations, the government is cracking down on violations very strongly for Korean nationals. Definite fine, a hefty fine at that. And even a year jail term, up to a year jail term as well, and foreign nationals will be deported immediately.
Right, that's something we'll be touching upon later on in the program. Now, Koreans residing overseas can cast their votes for the April 15 general elections, starting Wednesday.
That's right. So let's talk about the Koreans overseas. The voting has taken place from today, and it will go on for 6 days. There are about 172,000 eligible voters, Koreans overseas, who are eligible to vote, but about half of them won't be able to, unfortunately, because of this whole outbreak, with polling stations being closed. The National Election Commission has suspended election operations at 65 diplomatic missions in 40 countries, so quite the number amid the pandemic, and they include stations in the US as well as several European nations such as the UK, France and Italy, the hotspots of the COVID-19 outbreak at the moment. And that number could also increase depending on how the COVID-19 situation plays out. And some overseas Koreans are obviously not happy with the election watchdog's decision. Some Koreans in Germany, in fact, are planning to take legal action with South Korea's constitutional court and to seek an injunction to the closures. Excuse me.
I see. Now, we talked about this yesterday. Aram, the finance ministers and central bankers of the G20 nations held a virtual conference yesterday. What was discussed then?
Yeah, so this was the second meeting. They directed working groups to come up with a roadmap for a joint action against the pandemic by April 15th. So they actually set a definite deadline for a concrete plan to tackle the outbreak. They also pledged to provide financial aid to poorer countries affected by the pandemic. We've been hearing of this as well. The financial chiefs also stressed the important role the IMF, World Bank and other international financial institutions play during this crisis. The World Bank, in fact, has already announced a $160 billion relief package to be deployed over the next 15 months to support the G20 nations. So, as well as the poorer nations, the G20 nations themselves need support as well. And so that measure has obviously been welcomed by the G20 group. In the previous meeting, the group also agreed to inject $5 trillion into the global economy. So there are more funds pumping in there. Seoul's finance minister, Hong Nam-gi, meanwhile, proposed that more central banks should engage in currency swap deals to kind of alleviate this liquidity crunch and stabilize the currency market, which has been taking a hit, as well as the stock markets, in fact. And Korea and the US have signed such a currency swap deal in to the tune of $60 billion. $12 billion of that has already been injected into banks here for the banks to in the first round of dollar lending at the moment. And Hong Nam-gi also stressed that the IMF and other global financial institutions should review a possible expansion of what is known as the special drawing rights, or SDR. Now, this SDR is an artificial currency built from a basket of major currencies like the dollar and the pound. And the IMF actually allocated about $250 billion in SDRs during the 2009 global financial crisis to inject liquidity into the global economy. So we could be seeing that measure again.
Oh, I see. Okay, Aram, thank you for that.
Thank you.
Again, both of you, we'll see you again tomorrow with the headlines. Thanks. Now, it's about 10 past 2 in the afternoon here in Korea, and we are poised to join the Central Disaster and Safety Countermeasure Headquarters for the latest briefing on the COVID-19 situation in this part of the world. Starting from today, as our No Aram announced, all arrivals to Korea, regardless of your departure destination, are expected to self-isolate for 2 weeks. Those without local addresses can stay at government designated facilities at their own expenses. Meanwhile, foreigners in the capital city, sidelined from the country's mask rationing system, can get their masks from the Seoul Global Center. Here now is the briefing.
Let us now begin our regular briefing for the coronavirus outbreak here in Korea. As of today, midnight, the total number of confirmed cases stands at 9,887. This includes 560 imported cases from the overseas, and 40 of them were foreigners. And of them, 5,567 have been discharged following full recovery, which are about 50% of the total confirmed cases. We had 101 more confirmed cases as of yesterday, and 159 more people were discharged yesterday following full recovery. We had 3 elderlies who passed away yesterday. I extend my deepest condolences to those who have passed away and their bereaved families. And the regional breakdown is as follows. Yesterday, the newly cases, out of the 101 that have been reported yesterday, 24 were from Seoul. And Seoul City, most of them were the cases that were imported from abroad. And we are still currently tracing the contacts of the Manmin Central Church in Gurogu District. And Daegu, we had 20 new more cases yesterday, and most of them were from the Hansarang Nursing Hospital, as well as other hospitals and multi-use facilities. And in Gyeonggi-do province, we saw 23 more people confirmed. They were related to the contacts of the church called the River of Glory in Gyeonggi-do province. And the Gyeonggi-do province also saw an increase of the imported cases from abroad. And also we have newly reported cases of Ujeongbu St. Mary's Hospital. And yesterday, 7 more cases were confirmed at the airport quarantine. Of the total confirmed cases, about 83% were related to cluster infections, and about the rest, 15%, are related to sporadic outbreaks and those undergoing investigation. And regarding the Ujeongbu St. Mary Hospital, we have seen 6 more new cases. Now the total stands at 13 at this specific hospital, and they are also testing every one of the patients and the staff members, and we are also putting on quarantine the entire floor where the outbreak broke out. And of the 13, 5 people were inpatients, and 6 were the staff members, and 2 were the families. And in Songpagu, we saw an outbreak at the Asan Hospital, and we have witnessed that this person who has been tested positive has been to the Ujeongbu St. Mary's Hospital. So we are contacting tracing the contacts, and all of the contacts are being under self-quarantine. And we also are currently carrying out a quarantine on all of the 200 patients that have come into close contact. And in Gurogu, regarding the Manmin Central Church, we have 8 new cases who were on quarantine, and a total of 41 people have been confirmed from this church. And 39 were the church members, and 2 more people have been reported positive through the contacts. And in Daegu, we saw 11 more cases at the Hansarang Nursing Hospital, and also Daesil Nursing Hospital were 3, and 1 person at the second major hospital were tested positive. And we're also conducting an investigation on all of the caregivers at the hospitals in each of the regions of Daegu, and we have tested some positive cases, so we are tracing their contact as well. During the past 2 weeks, we looked at the infection routes, and 35% were related to imported cases. And regarding nursing homes and hospitals and other group use facilities were about 40%. And related to church and other businesses, 6.5 were related to that. And the rest of 6.5% are still undergoing investigation. we are seeing a higher increase of the number of imported cases. And this is the cases for yesterday. 36 new cases have been reported from yesterday as of for the imported cases. And 4 people were from Asia, excluding China, including Indonesia, Thailand, and the Philippines. 14 from the Europe, and 17 from US, and 1 person who traveled through various countries in Africa, including Zimbabwe, also was confirmed positive. And at the airport, we had 15 cases, and throughout the community, we had 14 cases. And 3 of them were the foreigner, and the rest were Korean nationals. And right now, the total number of imported cases count to 560, and of them, 514 are Korean nationals, meaning that 90% of these people are Korean nationals. In order to effectively curb the imported cases, we have intensified our screening on the imported cases, and we have seen a decrease in the number of those who are traveling to Korea. And we are also mandating short-term travelers to have on quarantine. So we believe that this measure will continue to contribute to decrease the number of the inbound travelers. And in the early March, we have seen about 900,000 people coming in throughout the week, and this has decreased significantly to about 10,000 right now, and we have seen a great decrease in the number of inbound travelers. And seeing a global outbreak of the pandemic starting from midnight of today, we have been intensifying our screening on the inbound travelers. We are mandating all Koreans and foreigners residing in Korea arriving from all overseas countries to be subject to self-quarantine for 14 days upon entry. And this will also be required for all of those short-term travelers. And there are some certain limited cases, including diplomatic or official duty. And in order to decrease and curb the further spread of the imported cases, until throughout their self-quarantine time, they have to participate and go follow on the quarantine measures put forth by the authorities. And when they return home, we ask all of them to use their own vehicles or use the KTX train or the designated limousine buses. And they are also required to wear face masks during this movement. And we are also seeing an increasing number of the contractions within their families. So we advise you to not share your utensils, towels, or any other personal belongings, and please abide by the quarantine measures. And if you have come into contact with those people who are under quarantine, we advise you to wear face masks and ventilate your houses and clean and disinfect surfaces that are frequently touched. And if you have any suspicious symptoms, please report to our authorities and call the call center at 1339. And for those of you who are not mandated for the self-quarantine regulation, we advise you to stay at home if you have just arrived from overseas. And please keep your sanitary practices. And if you have any symptoms, please report through the application or the call center or the local screening centers. Up until April 5th, we are carrying out our enhanced social distancing measures. This is being highlighted numerous times, but we advise you to stay at home as much as you can and minimize contact with the co-workers at work. And we also refrain you from going to closed door sites which are crowded, including religious activities and indoor fitness or sports facilities. Also, it is important to comply with the hygiene measures as well. And the KCDC has also conducted our third round of questionnaire on the risks of the coronavirus, and we have looked into the aspects of how much our public is complying with the enhanced social distancing campaign, and 90% of the respondents said that they comply with this measure, and we hope that this could go on during the future, and we would like to thank you very much once again for your participation. We carried out a survey for the past week on 1,000 adults here in the nation, and we asked them how much of you are complying with the enhanced social distancing campaign. Over 90% and nearly 95% said that they refrain from going outdoors and they refrain from going to religious gatherings. And we have witnessed that many of our public are engaging in the enhanced social distancing campaign. And we also asked them if you have anyone to consult in terms of coronavirus, and 83% of them said yes. And also we asked if you have people to share your difficulties during the time of isolation. Over 90% said yes, but more than 5% said that they do not have anywhere to rely on. And at this difficult time, I believe it is very important that we send words of support and encouragement to our family members as well as our friends in order to reduce and minimize the social trauma that could be inflicted by the virus. And the KCDC also sends our great sincere gratitude to all of the medical practitioners who are fighting on site, spending sleepless nights, and we will spare no efforts in supporting them. Recently, we have seen great dedications put forth by the medical practitioners, and this has been helpful in reducing the medical collapse of the regions, including in Daegu and Gyeongbuk region. And we also saw many people who voluntarily went to these disaster places to help out. And we would like to thank you once again for all of your dedications and contributions. And they have contributed greatly in treating our patients. So I believe that these people are truly our heroes of the society. And the authorities are closely coordinating with the medical staff so that they could continue their fight against the coronavirus. And I hope that all of our public can send words of encouragement and support to these medical practitioners. Thank you very much.
Right, and that was Chung Eun-kyung, the head of the Central Disease Control Headquarters, with the latest facts and figures on the COVID-19 situation in Korea. As announced, we have 101 new cases as of early Wednesday, raising our total to 9,887. Also, starting today, all arrivals to Korea will face a 2-week period of isolation, and you'll also be required to install a mobile app that allows authorities to monitor them in real time and ensure that they are abiding by the quarantine regulations. They'll also be able to report their condition via this app to the authorities. Amid the COVID-19 pandemic, health authorities worldwide have been warning of a fake news infodemic, a combination of the words information and epidemic, as misinformation about the virus poses a threat as dangerous as the virus itself. Accordingly, here in Korea, researchers have embarked on a project to ensure that the public is accurately informed with regard to personal health management under the current circumstances. Let's take a look.
이 프로젝트는 이제 중국에서 시작된 가짜 뉴스를 이제 분석을 해서 그 중에서 건강과 관련된 15가지 뉴스에 대한 이제 확인을 했고요. 그 15가지를 가지고 우리가 기존 문헌 그리고 뭐 교과서, 뭐 WHO 자료 가지고 사실 확인을 했습니다. 그래서 이 사실 확인한 15개를 가지고 지금 13개 국가의 언어로 번역을 해서 사람들에게 이제 이것이 사실인지 아니면 진짜인지 알릴 목적으로 제작을 해서 이제 공개를 하고 있고요. 가장 흔하게 마스크 관련해서는 뭐 전자레인지에 돌려서 마스크를 재사용할 수 있다, 혹은 뭐 알코올 스프레이를 뿌려서 마스크를 재사용할 수 있다, 혹은 헤어드라이어로 마스크를 뜨겁게 달궈서 사용할 수 있다, 이런 가짜 뉴스들이 있었고요. 뜨거운 물이나 뭐 뜨거운 차를 계속적으로 마시면 뭐 바이러스를 씻어낼 수 있다, 이러한 가짜 뉴스들이 있었습니다. 독성 물질이나 안 좋은 물질을 섭취하거나 이래서 죽음에까지 이르는 경우도 있을 수가 있겠고, 아니면 사람들이 집단 발병을 하는 경우도 있을 수 있겠고요. 도움이 안 되는 것에 시간과 돈을 소비하게 되면서 진짜 바이러스 예방을 위해서 해야 되는 행위라든지 구비해야 되는 물품들에 대해서 기회를 놓치게 되는 거죠. 가짜뉴스를 예방하기 위해서는 사람들이 이제 공인된 기관에서, 이제 예를 들어서 한국에서는 질병관리본부라든지 아니면은 세계보건기구 혹은 뭐 주요 이제 의료기관에서 제시하는 정보를 보는 것이 제일 좋은 방법일 것 같고요. 그리고 명심해야 될 것은 얼핏 보기에 너무나 이제 쉽고 너무나 이제 매력적으로 보이는 방법인데 주요 기관에서, 공신력 있는 기관에서 언급하지 않았을 때는 그것이 가짜 뉴스일 확률이 매우 높습니다. 정말 그렇게 좋은 정보라면은 공신력 있는 정부 기관이나 아니면 공신력 있는 기관에서 이제 대중에게 언급을 이미 했겠죠.
The US now has the largest number of COVID-19 cases, and authorities are predicting the death toll could reach as high as 200,000 in the worst case scenario. For a glimpse of the situation there, we connect live with Elaine Yu, a YouTuber who lives in California. Hello, Elaine.
Hello.
Hi.
Hi.
You can hear me, right?
Yeah, I can hear you.
Elaine, perhaps we can start with the overall atmosphere in Silicon Valley where you live. What is it there like right now?
So I live in San Jose, Silicon Valley, and all the schools are closed until May 3rd. And I think it will end up being the close for the rest of the school year. So kids are staying home and doing school work online. So it's a lot of work and adjustment. Make sure the kids are doing their work and learning, and at the same time, I'm doing housework and prepare meals for 4 people, including my husband, for all day. So I've been talking to other moms, and they are all stressed and scared of getting sick. So my husband is currently works from home, and a lot of bigger companies, Bay Area, allowing their employees to work from home if they can. But at the same time, they're worrying about the layoffs.
Right. So a lockdown has been placed in order for the public there as well. How are members of the public responding to this lockdown, Elaine?
The lockdown, the starting on March 16th, the shelter in place and lockdown was issued for the San Francisco Bay Area, including Silicon Valley, and recently extended until May 3rd. So we are supposed to stay home unless the grocery shopping and doctor visit and the essential the activities. But we have to stay 6 feet away from the people. Otherwise, we might get a ticket from police. Anyway, we're all getting a little stir crazy. The staying home most of the time. Yeah, so we go out to walk the dog and get some fresh air. Yeah.
Elaine, are you facing any shortages in supplies of basic necessities? I mean, we keep seeing news of empty shelves at stores, and there's much talk about the absence of toilet paper there. Is this still the case?
In the beginning, so when the shelter in place was announced, the people were buying in bulk and hoarding, but a couple of weeks later, so it's getting better. But so we have no problem getting food, but it's still hard to find the toilet paper, the paper towel, mask, and the gloves. But especially mask, mask is a little easier than before to buy online. But still, we have to wait at least 2 weeks, 2 weeks to delivery. So, but I heard from one of my friends, the Korean market starting to sell the mask right now.
Oh, I see. Well, that's comforting to know. Elaine, is testing easy for those who report possible symptoms of COVID-19?
Oh, so I don't think that it's easy. I think a lot of people here still don't know the how or where to get the coronavirus test. So I heard that since there's not a lot of people test is available, so you have to have at least a symptom or have travel outside of a country, at least over 55 years old, have a contact the someone who has a coronavirus. To be able to test, but I also heard the doctor to refer to get tested if they have their own insurance. But I'm not sure about without people have an insurance. Yeah, I don't think that people is gonna go to hospital unless they have a really sick or serious condition because it's expensive.
Of course, of course. Elaine, have drive-through testing centers been set up where you live?
Yeah, so in San Jose, we have one drive-through test center. So I just found out there's one nearby home, and but it's only for members. So with the hospital network Kaiser. So that means people who don't have a Kaiser insurance, so they can't go even though they may have the coronavirus. So yeah, I'm not sure about these people who don't have insurance. So they have to figure out, where they need to go. So that's our situation here right now.
All right, Elaine, thank you very much for making the time to share your thoughts with us. That was Elaine Yu, a YouTuber from California.
Thank you.
Now, with countries worldwide imposing tough restrictions on movement and on activities that could endanger public health in light of the COVID outbreak, there are indeed cases of violations. In today's studio discussion, we'll delve into those dangers and more.
여전히 집단시설 감염 사례와 해외 유입 사례가 나타나고 있습니다.
Right, in today's in-studio discussion, we delve into the dangers of violating quarantine measures set forth by the government. We have here with us Professor Lee Hyun from Handong University.
Thank you.
Welcome, Professor. And we have our freelance journalist, Rafael Rashid. Welcome, Rafael.
Hello, thank you for having me.
We'll start with you, Professor. What is your overall assessment of the cooperation shown by the Korean public to the government's quarantine measures?
I think it's been relatively very good, actually, considering the situation that Korea is facing. Maybe it's too early to be self-congratulatory, but at this point, given the circumstances, the Korean public has been very cooperative. They've practiced good hygiene. I think they've really taken to heart the government's instructions in terms of how to deal with the crisis. And I think that has to do a lot to do with the high level of social trust in Korea. Given the circumstances, Korea's had to deal with many external threats in the past. And I think this is an example of sort of national unity in the face of a crisis such as this. And so at this point, I think the assessment is very, very good on the Korean side.
Right, Professor. Raphael, would you share his thoughts?
I think I would agree with him definitely. You know, especially the response here has been, I think, has been quite exceptional. And you know, definitely wherever you go, you can get hand sanitizer wherever you go. People are checking your temperature wherever you go. I agree with him.
Right. Professor Lee, students studying abroad, Korean students studying abroad, are now coming back in light of the pandemic, and some of them have found themselves in hot water after violating self-quarantine measures. Do you care to elaborate?
There was a recent case involving an American student and her mother who live in Gangnam, but they traveled to Jeju Island for a vacation. And despite the symptoms that they experienced, they went ahead with the trip. And during the 5 days that they were visiting various places, tourist sites, businesses, they came back and were then discovered to have a positive test for the coronavirus. And so you can imagine that the Jeju residents, as well as the provincial government, is very upset by this. This has caused 20 businesses to temporarily close, but also to force the quarantine of over 90 residents of the island. And so the Jeju government has now sued, started a lawsuit where they're going to try to get damages from these individuals in the amount of about 100 million won in order to cover their losses. And so I think this is an example where a lot of people have expected the Korean public, especially for individuals in Korea, to make sure that they toe the line when it comes to being careful with respect to others. And I think this is an example where someone is being reckless, potentially, and therefore the Korean public, I think, reacted very strongly against this.
They did. Let's shift our focus to Europe, Raphael, where many countries have ordered citizens to stay at home and they've closed down borders. What kind of punishment can people there expect if they break government guidelines?
Yeah, if we look, for example, at the UK, if someone refuses to follow the rules, because at the moment there is a policy of social distancing, so you have to stay at home. But if you break the rules and you do not have a valid reason to be outside your house, police can enforce a fine of up to £60, which is about 90,000 Korean won. And this could potentially become more serious and even go to the courts if necessary. In France, the government has issued strict rules on movement. People are not allowed to leave their houses without filling out a form. And if you do not have this form and you do not have a valid reason for leaving your house, police can enforce a fine of up to 135 euros. And similarly, in Italy, people who break quarantine rules and are found venturing on the streets for whatever reason, they can face fines of up to 3,000 euros.
I see. Aside from these fines, Professor Lee, we heard of a case recently in the US. A Florida pastor was arrested for holding church services despite the stay-at-home order. Here in Korea also, there are some who continue to attend church services and to engage in crowded indoor activities against recommendation. Well, recommendation is just for you to stay at home, but they do so. What kind of penalties do these people face here in Korea?
So there are city and regional regulations in place, administrative regulations essentially, that prevent individuals, or at least suggest to individuals that you may not do certain kinds of activities, but also place responsibility on various institutions with respect to people who enter their facilities. So for instance, in many of these regulations require that the institutions will make sure that they wash their hands before they enter, that everyone's wearing a mask, they take attendance of people who come to the facility. They also make sure that they practice social distancing. And if an institution fails to do so, then there could be potential fines. And so I think it's important to know at this point that, as you mentioned, that these are voluntary measures essentially. But if there's someone who breaks these regulations, there's a fine that could be potentially put in place. If there's a second violation, up to about several million won. And then also, if this goes on further, there could be a ban on future gatherings. But I think it's important to note that it's a very big difference between what you're experiencing in Europe, but also in the United States, where you have stay-at-home orders, you have essentially lockdowns. But the Korean government has taken a different approach to this, which I think is very commendable in this case because of the protections for individual liberties, the freedom of movement. And I think this is something which we'll have to maintain and see how this continues forward.
Right. Raphael, over in Saudi Arabia, the country is even considering, I understand, capital punishment, the death penalty for those who violate rules. What are your thoughts on such severe forms of punishment?
I mean, that's a very difficult question. I think we are in unprecedented times, and I do believe that significant penalties should be enforced if we are going to contain this virus, not just in Korea, but around the world. And in South Korea, the government has implemented a kind of zero tolerance policy. I think President Moon said the other day, a small hole can break a dam, which I fully agree with. One person can, ruin it for everyone else. So I do think we need these, we need tough measures. In Europe, for instance, they are increasing the fines. I think, for example, in Italy, it was just it was like a few hundred euros. Now it's a few thousand euros. So they are increasing the fines. Again, I do agree with these strong measures. However, when it comes to a death penalty, I think that is slightly a different issue. I do believe it is excessive, and I think there are other means other than going for such extreme measures.
And speaking of other means, earlier on during the briefing, we heard of Korea's plans, for example, to impose fines as well. And of course, for Koreans, they might even face jail time if they violate the 2-week self-quarantine measure after arriving from abroad. What are your thoughts on this, Professor Lee? Is that viable? Is that possible?
Well, I think in terms of the Korean regulations, the Infectious Disease Control and Prevention Act provides for strict measures to be applied upon individuals who do, in fact, violate quarantine regulations. But this is a classic problem with respect to governments and individuals and groups with respect to fundamental civil liberties and freedoms that the public enjoys. And so while there's clearly a interest for the government to protect the public in these kinds of desperate measures and desperate times, but there's also the balance that has to be achieved with respect to fundamental liberties that groups and individuals do enjoy under the Constitution.
Some claim that Korea's measures at the moment are relatively light compared to those of its counterparts worldwide. Do you agree?
I think it's true that in terms of comparisons versus a lockdown and a stay-at-home order that's given by the U.S. states, the governors have ordered people to literally stay in their homes with certain exceptions. Korea, of course, doesn't do that. We can go outside, we can go shopping, we can attend our religious services, subject to very strict social distancing regulations. So in that sense, there is the view that Korea is achieving something which is quite different than what you're finding in other democracies. And I think a lot of people look to that and say that that's a great success, actually, if Korea can maintain that. Now, if you see a spike in the number of infections going forward, then this may change. But I think what you're seeing in Korea is, I think, potentially a model in the future for democracies to get testing done early, get the people on board, and make sure that everyone abides by these kinds of regulations that are in place to prevent this pandemic.
Mm-hmm. Raphael, what are your thoughts on our preventative measures in response to COVID-19?
I think the measures that we have seen in Korea thus far have seemed to be working, and the curve, so to speak, seems to be flattening. And in Korea, there's probably, the most ambitious testing program we have seen. And the government has certainly been successful at extinguishing the large fires, so to speak. Of course, there are smaller cases every day.
Cluster infections.
Yeah, of course. And, this shows us that this is by no means the end, and we have a long way to go before this is fully over. But I think, ultimately it's up to all of us to abide by the rules, to stick to the quarantine if necessary, stick to personal hygiene. I understand, at the moment it's spring. At the weekend, I took a walk and I could see a lot of people seem to be a bit more relaxed, a few less face masks, sitting under cherry blossom trees. I understand it is springtime, but it is also very important to maintain the social distancing that the government is urging all of us to do.
Of course, the government has called on us not to let our guards down.
Exactly.
Which we will not. All right, I think that's all the time we have for now. Professor Lee, thank you for your thoughts. And Raphael, thank you again for being here with us.
Thank you.
Right, on that note, we end today's coverage of the COVID-19 pandemic. We'll be back tomorrow at the same hour, so do join us then. In the meantime, do share your thoughts and inquiries with us through our social media accounts. Thank you for being with us.